At Sarasota Memorial Cardiopulmonary Rehab, after a referral from the patient's doctor, they will be scheduled for their initial evaluation. This is the room that the evaluations normally take place in. During this time, the exercise physiologists gather all the necessary information needed to write the exercise prescription for the patient. This is where the patient will begin their first day. Here is where we take their blood pressure before the exercise session and after the exercise session. After the patient's initial blood pressure is taken, the cuffs will go in the gray bin, which lets the staff know they need to be cleaned. We wipe them down front and back with wipes and put it back in the bin. Once the cardiac patients are finished with their workout, they'll take off their monitor and also put it in the bin, which also gets wiped down, as well as the necklaces that were used for Here's what the heart rate monitors look like. They each have a number, and the patient is assigned a number based on their last name, and this goes into the computer as we monitor them during their exercise session. There are 3 leads to hook up to, and the staff must make sure that they're hooked up properly in order to get a good reading on the monitor. Many pulmonary patients wear oxygen, which we supply to them for their workout. We also supply the nasal cannula. We take their oxygen saturation and their heart rate during their workout with the pulse ox, and every Thursday there's a different education packet that we hand out to the patients. This is where the exercise takes place. We have many different aerobic machines and many different strength training machines. Each patient will do 30 minutes of aerobic exercise, followed by 4 different weight machines. During the patient's initial evaluation, there's a portion for a stress test. The stress test would be determined by the exercise physiologist for the patient, and based on the results of that test would be how the exercise prescription would be written. So everyone's exercise prescription is very different and individualized. Here's just a quick walkthrough of some of the different weight machines that we have and some more of the different aerobic modalities that we have, and then we also have some free weights in the corner. And the exercise physiologist will take the patient on their first day to each of the 2 different aerobic machines, show them how to set it up, and describe their exercise card to them, and then show them the different weight machines and how to do them, and describe the sets and reps to them as well. All right, please say your name and your certifications.
My name is Lisa Pearson, and I have my bachelor's of science degree in exercise science, and I also am certified through the American College of Sports Medicine as a clinical exercise physiologist.
And what role do you play in my internship experience?
So I'm the preceptor for Florida Gulf Coast interns. So I just oversee, their internship, and basically that's it.
Thank you. All right, please tell us your name and what you do here at Cardiac Rehab.
I'm Justin Pappas. Here at Cardiac Rehab, we prescribe exercise as well as monitor patients in both the cardiac and the pulmonary realm. We watch EKG rhythms, and we also help patients on the exercise equipment.
Thank you. All right, please say your name and what certifications you have.
I'm Deborah North. I'm a registered respiratory therapist. I also am certified in pulmonary rehab, which is actually my specialty.
All right, and what role do you play in my internship experience?
I do like to take the interns. I really think that it's important the interns understand the basics of pulmonary rehab and also dealing with lung disease patients. They are a completely different type of patient than a cardiac patient. Their needs are completely different. I think it's important to understand the basics of oxygen, the importance of what the oxygen is doing for those lung patients, and also the basic lung diseases that deal with pulmonary rehab patients.
Thank you.